Travel is more than just ticking off countries. It's about the people, the culture, the food, the moments. I'm Pippa Hudson, and on Wonder the World, I invite you to join me every week as we explore destinations both near and far, with the help of fellow adventurers who share their unique travel stories. Listen to my podcast wherever you get them.
PrimeMediaPlus.com, your connection to what matters most.
Hello, everyone, and welcome to this episode of the Teen Junction podcast. My name is Cindy Poluta, and as always, I'm so grateful and privileged to have you listening to this podcast series, one for parents, where we hope to tackle teenage issues and give you the tools to help you move forward. Whether you're listening to us on Prime Media Plus or on YouTube, watching us on YouTube, we are always so glad to hear from you. You can DM us on our Facebook page, our Instagram page. It's all there. We've loved hearing from you. Any show suggestions you might have for us, please give us a call. Let us know. Well, not a call because it's social media. Hit us up on the Instagram and the Facebook. You guys know what I mean. So today we're going to be talking about brain injuries because March is Brain Injury Awareness Month. And you might be going, hang on, Cindy, what has that got to do with teenagers? Well, actually, a lot more than you think. We're heading into a very busy sports season. The rugby has started. The cricket is finishing. The netball starting, there's cheerleading, there's hockey, and your child might be actually more at risk of getting a brain injury now than what you realize under concussion. So with me today is occupational therapist Michelle Cahi, who specializes in neurology and practices in her private capacity as well as at Headway Gauteng. Michelle, thank you so much for joining us today.
Well, I'm very welcome, Cindy.
So just briefly, what is concussion? I think a lot of people hear the word, they kind of think, well, it's a knock to the head, the child will be fine. But actually, it's a lot more serious than we realize.
Yes, Cindy, unfortunately it is. And people don't realize that concussion is actually defined as a mild brain injury. And when you say it like that, you realize that it's actually more serious than just something that a child sort of experiences on the side of the field and can get up and go and play their sport again. But it's not that at all. And there are some serious effects. They could be short-term, and they usually are. But often there can be subtle changes or more severe changes, as we'll go into just now.
So what is the difference between a mild concussion and a very serious concussion?
So a mild concussion is a possibly no loss of consciousness or a very brief loss of consciousness on the side of the field, or whether it be maybe a car accident. It doesn't have to be sports. It could be a car accident. It could be a bicycle accident. Anything where you have a jerking movement to the brain. So I brought my Brian, the brain. I brought him Brian.
Oh, he looks gorgeous.
Just to show you what actually happens in the brain. So inside the brain, we have different blood vessels. And on the top of the brain, we have smaller blood vessels that attach to the skull. Inside the brain, we can see that the blood vessels become larger. And also, where there are blood vessels, there's going to be nerves. So what happens is as soon as you get any kind of impact to the head or even to the body, the brain can actually bounce inside the skull, causing shearing forces in the brain itself. So when the shearing forces happen, you will get small bleeds on the brain, as well as possibly bruising and damage to the nerves. So as you can see, it's not just something small that happens. It's actually the brain moving within the skull that causes the chemical changes in the brain. And that's when you get loss of consciousness, confusion, changes in cognitive functioning, as well as some physical changes.
So you're telling me that the brain can get bruised? Like I'm thinking I walk into the door, I get a bruise on my arm. My brain can actually move inside my skull. That seems crazy.
It does. And the problem is that with the brain, when there's a bleed or there's a bruise, it actually doesn't heal. So brain tissue, neural tissue, doesn't have the ability to really heal. That's why we want the bruising to calm down very quickly so that there's not too much severity of injury. So what actually happens with the concussion is that the loss of consciousness or the feeling of needing to rest is your body's way of trying to recover when the brain is injured. So the brain needs that energy to actually recover. And that's why it's actually very important to allow the person to rest, to sleep after a concussion, because that's the brain trying to heal from these bruises or this bleed.
Okay, so where does the old wives' tale come from then? That, like somebody gets hit to the head and everybody goes, don't let them go to sleep, don't let them go to sleep. Why? If we're saying, actually, no, the sleep is important.
Yes, that's an old wives' tale.
Okay.
You are actually supposed to allow the person to sleep if they need to sleep. Obviously, you want to check on their breathing while they're sleeping and their restlessness while they're sleeping. So as a mother, you're probably going to be walking into the room and checking your kid every 5 seconds. But your body needs to rest to allow the brain to recover. So let the child sleep. Don't try and keep them awake. You're only going to cause more confusion, more distress to the brain.
Okay, so straight after the episode. So let's say, for example, I've got a 8-9-year-old child at home. They're messing about. They fall off the back of a couch. They knock the back of their heads. They vomit, because I'm assuming that's one of the symptoms of concussion. And now I'm rushing them off to the hospital. And in the back seat, they say, Mom, I'm so tired. I just want to go to sleep. Do I keep them awake, or do I just go, it's okay, go to sleep, wake you when you get to the doctor?
Yes. So you allow them to sleep if they need to sleep.
Wow.
That is the brain recovering. Okay. So it's really fine if they sleep. Obviously, if there's a breathing issue or you see them in a form of distress, then, that's another sign of quite a severe injury. So we need to get them to the doctor. But yes, let them sleep. There's nothing wrong with sleep. In fact, it is indicated for a concussion.
Wow, I have learned something new today. So what are the symptoms of concussion? Because I've seen it, and this is not just rugby, guys. This is any sport where two kids come together and they bash heads, right? And the paramedic on the side of the field, who, forgive me, 8 times out of 10 is probably not qualified to diagnose a concussion, goes, no, this child's fine. Child looks fine. They almost send the child back onto the field. So what are the symptoms? Do they present straight away?
Sometimes they don't present straight away, which is the scary part, but often they do. So what paramedics or anyone should be looking for is headaches, confusion, neck pain, double vision, blurred vision, and sensitivity to light, hearing problems, and sort of problems with balance and coordination, so dizziness.
Okay.
So that's why these guys get asked, what's your name? What's your address? Can you tell us? Are you looking for speech issues and confusion?
Okay.
And also they shine a light into your eyes to see if the pupils become pinpoints. So light, when light is shined into your eyes, or it's very light in a room, your pupils become smaller. To not let too much light in. So if the pupils are now doing different things and sort of blowing big, or one is changing, then you know that there's a concussion and medical help is needed. Obviously, if there's a seizure, that's very, very clear that the brain has now, suffered a serious impact. And obviously also the physical body. So the body can be jerking, it can be also just moving, flailing. So we've got to look at those, as well as emotions. So we can get into that now, if you'd like, is more, the long-term effects of a concussion can also cause that serious emotional distress. So a day or two afterwards, your child may become quite emotional, depressed, irritable, aggressive. So there are also those changes in personality that can be seen.
And so often we go, oh, well, that sounds like a typical teenager. But what we're actually saying, and, let's all, for lack of a better term, use our brains and go, my child suffered a concussion 2 days ago. 2 days later, they're angry, they're emotional, they're acting up. This is too much. This is obviously the concussion acting out, right? Or the concussion playing out. How long does it take to recover from a concussion then?
So it can be a few days, it can be months, it can be forever.
Wow.
Depending on the severity of the concussion. So if we think about it, a concussion is a mild brain injury. And a brain injury doesn't just go away if it's more severe. So, we look at all the different symptoms and see, do they resolve? And, how long are they hanging there? And that is really the sign, the tool that we use to scale how bad the brain injury is. It's the length of time that the brain takes to recover.
I think it's very distressing because, as you say, there are some people who just never recover from it because, from your beautiful illustration that you showed us with the brain, the brain, and you said it, the brain literally can't rejuvenate itself. It's bruised. It's now damaged. And this is why I personally get so infuriated when I speak to parents who go, oh no, my child, they were concussed last week, but it's fine. They're playing this week. And there's such a big bravado and emphasis put on school sport, regardless of the sport. I'm not aiming this at any sport. And parents living through their kids to rush them back on because it's first team and the first team needs you. And 1 week later, you're playing after suffering a concussion. It's just, for me, Michelle, that feels madness because I don't think people realize what a second concussion can then do.
Absolutely. And that's the issue as well, is that, these rugby crazy schools, for want of a better word, and I saw it firsthand because my brother was in one of those schools and he was a rugby player. They actually can go to the point of keeping a child back in matric to play rugby for the school again. So that's how important it is to the school that the child continues to play. And if we look at statistics, people who suffer concussions are generally more males than females, ages 15 to 19, and also 0 to 4, because we mustn't forget that little babies and kids don't have the understanding of that lack of consequence if you fall off a chair or you come and you think you're Superman and, you jump. They don't understand that. So we've got the 0 to 4s, and then we've got the 15 to 19 boys. Yeah. And these are the risk takers. So these are the boys who we've got to understand that kids that age, until they're 25, their brains and their bodies haven't completely developed. So concussion onto a developing brain is a very damaging thing. It's the brain is extremely susceptible to that damage. And we've got to realize that with brain injury, the major symptom that really doesn't go away if it's more severe is that concentration issue and short-term memory loss. So that is something that is tested and is seen for a long time until that concussion resolves.
Sure. And I think there's so much more education around concussion now that we really have no excuse. We know the long-term effects. We know what it does. We should, as parents, be taking responsibility and go, actually, it is school sport or it is varsity sport. This is not a long-term career. Even if it is a long-term career, this is going to affect my child mentally down the road. Depression, anxiety, all that kind of stuff. So I always wonder how accurate, all the schools send out I think they have to. I think a lot of the big sports make it important and prerequisite that in order to play the sport, you have to have a concussion test. How accurate are those concussion tests at the school? And should we maybe be taking our kids to somebody else who knows more?
I think they're extremely important, Cindy, and they are standardized tests, and they've become really, really well executed and do measure all the important parts of the brain, such as reaction speed, short-term memory, concentration, behavior, personality. So they're given a really good indication. And that's why it's important to do the baseline concussion test so that the medical professionals can get a good idea of the functioning, the cognitive functioning of a child or a person, whoever, whatever age. So that if they have a concussion, they can retest and see, wow, this has changed or this hasn't changed. And the test can also show when the child is ready to go back and play the sport.
Wow. So, Michelle, you mentioned the Neuroflex test. What is that about?
So the Neuroflex test is the actual standardized test that is used. There's also another test that's used called the impact test. But Neuroflex is generally used in South Africa, and that's the one that would test for all the things that I previously said, cognitive, physical, and it's actually very much like a video game. So the kids actually enjoy it.
Okay.
They check out their reaction times and cognition and that kind of thing. So it's a good test, and it is standardized and overlooked by doctors.
That's so super. Yeah, that's super clever because the kids are almost playing a game. They think, oh, let me check my reaction time. There's no cheating that kind of system, right?
No, you cannot cheat it. And as I said, it's standardized. So it's a good way to understand where the child is.
So now let's say I'm listening to this podcast. I'm thinking back to my high school days and I'm like, oh yeah, I once actually had a concussion. What happens if I suffer another concussion as an adult and I go, oh, it doesn't matter because I had one like 30 years ago. Should I be worried?
Yeah, the research does state that if you've had a previous concussion, you may be more susceptible to a severe injury. And that's also why medical professionals do insist that people do not take part in any form of exercise or activity that could cause another concussion. So that's why kids are supposed to sit off the field for at least 6 weeks after a concussion.
Wow.
Because what can happen is something that we call secondary impact syndrome. And in my time of treating people with brain injury, I've seen a person with 2 successive concussions that has ended up with a severe brain injury. So you've got to be extremely careful that if you are at risk of another one, this is what can result is the secondary impact syndrome, and it is a real thing.
So what does a severe brain injury look like in an adult? I mean, what you're saying to me actually frightens me because I think about when the Springboks play. And then you see Faf de Klerk go off and he's got 10 minutes to go go off the court and pass his, head impact assessment. And he's got 10 minutes to come back on. And if he doesn't pass it, then he's out for 2 weeks. But you're saying 6 weeks. And I'm just hearing the outcry from the country when a top Springbok goes off. Imagine them telling us he has to be off for 6 weeks. But it's actually very serious.
It is. And that's why the standardized testing is very important because that's what tells the professionals and their coaches, the length of time that the person needs to stay off for. They know, okay, this was mild. In 2 weeks' time, he should be fine to get back on. And obviously, the Springboks and the likes, very, large, not school rugby, they know. They would not take with their players. Yeah. So, the real concern is the school rugby and possibly at club rugby level where they need the players and they force them back on before really testing them and screening them properly. And, if we look at it also in the first 48 hours, you've got to limit all activity. So kids, not sit them in a dark room and they mustn't move, but they're not allowed to look at screens. They shouldn't be looking at their phones, texting, TV, video games. Even they're not supposed to be doing schoolwork or reading. So I don't know what the heck they're supposed to do.
Just sit
they're
there.
Not supposed to do anything. Like, sit there, rest, sleep, listen to music, chill out. And it is a very long time for a teenager not to go onto, their phones. But it's really important because that's what heals the brain is very little stimulation. What's really important to tell these kids is that they're not allowed to drink. They're not allowed to drive. They're not allowed to do chores. Sorry, parents, but they're not allowed to do any strenuous exercises. And only after a while can they gradually go back to no impact sports. It could be like a stationary bicycle or walking, those kinds of things. And at this stage, sleep is very important because obviously that is when our brain switches off and is allowed to recover. So,
I mean, it makes perfect sense because you literally showed us how the brain is like suspended inside your head. Now, if I go and I run, even if it's a casual jog, my brain is going to be moving. So you wouldn't run with a sprained ankle. So why would you run with a sprained brain?
Absolutely. We've got to remember that, I always look at the brain as a muscle. And, that's how I try and explain it to patients is that, you don't go and damage a muscle when a muscle is already damaged. You don't go and strain it again. You've got to wait for it to be better, completely better before you start, taking risks like driving, like getting back on a bicycle. And my all-time favorite is boxing or fighting. I can't even watch it. That just I don't understand that sport. But yes, we need to rest the brain. It's not something that you can play around with. Like I've said, you've got that secondary impact syndrome that is there and it's real. And you don't want to mess around with that. A severe brain injury is really not something that you want to have to deal with. It's for the rest of your life. It's living with problems in your cognition for the rest of your life. You may not be able to work. You may be paralyzed in a wheelchair, unable to speak, unable to eat, a complete sort of invalid state. So, you're playing with your life. You really are. And that's how important it is.
I'm so happy that you're drumming home how serious concussion is. There is a term called CTE, and I obviously am not a neurologist, so I always forget what it stands for, but there are so many professional rugby players who have come out and said they struggle with CTE and it has ruined their lives. And everybody, when we were growing up, the worst concern was that your child would end up in a wheelchair from rugby. And I think you need to reiterate that if somebody gets CTE, it is a brain injury, which actually they're going to live with depression and anxiety for the rest of their lives. And we've started to see former players, committing suicide, not just in rugby, but in NFL as well, where there have been serious brain injuries.
Correct. Their whole personality can change. So it can affect your ability to have relationships. They change as a person. They are very short-tempered, could be very aggressive. So, generally, I'm speaking very generally, but wonderful, amazing sports people are aggressive or real go-getters. And those people that have that tendency after a brain injury are very often more aggressive and lose their temper very quickly. And that results in problems in their relationships with their family, with their friends. So yes, they get to a point where they are so depressed that they can't manage their lives.
I mean, it's reached a point, and I'm going to look down at my screen now, and I'm just, because it's so passionate about it, because I think parents need to know schoolboy rugby is not the be all and end all. And I've said this before, your child has a 1 in 23 chance of making the Springboks. It's really not worth rushing them back on for a small little school game that is not trials, that is not their future, that is not SA Rugby trials, that is not, it's just a school game. And hundreds of former rugby players are actually taking World Rugby to court and the Rugby Football Union and to court over saying they were not protected, their brains were not protected. They're now suffering from CTE. Rugby players like Alex Popham, Steve Thompson, Carl Heyman, Ian Bucket, and Billy Guyton. Billy Guyton is a former Maori All Black who died by suicide. The family donated his brain to a sporting brain bank so that they could actually analyze his brain and just show how damaged it is. And I get goosebumps because I get so angry that people don't realize that concussion is serious. Sorry.
Serious.
And I won't actually apologize. Sorry is not the word. Thank you. I should say thank you for listening to my monologue, Michelle.
No, as you say, Cindy, we can't play around with this. And it's something that the schools really need to understand. This is serious. And at the same time, we're looking at spinal cord injuries. You realize that the jerking movements in the brain often, can also result in spinal cord injuries. And that's also another issue. So those tackles, those unsafe playing is majorly, it's a major issue. And it should be well screened, and coaches need to understand how important the wellness and health of these children are, and it's more important, as you say, than just winning a rugby game.
Michelle, before I let you go, I know that you work at the Headway Centre in Gauteng, which is in Johannesburg, and you guys do phenomenal work. And it is Brain Injury Awareness Month. March is Brain Injury Awareness Month. Do you just want to touch on what you guys do, who you open to, how people can get help from you?
Cindy, Headway is a phenomenal organization. It's an NGO, and we are there to assist people and their families and loved ones with counseling, as well as a day program where a patient can come in for the day, socialize, get cognitive and physical therapy to improve their lives. Often people with brain injury cannot go back to their work. So we see a lot of people who have had car accidents, bicycle accidents. The thing is that off-road cycling now is causing a lot of brain injury because people come off their bikes over the handlebars when they hit a rock. So we're seeing quite a bit of that. Motorbike accidents, but we also see stroke victims. We also see people that have had to have brain tumor removals, any form of brain surgery. So anyone that suffered an acquired brain injury or a traumatic brain injury is welcome to join Headway as a member for counseling or for the day program. And it's just such an amazing place. I've worked there for 20 years. I can't seem to leave it. It's my Hotel California. And the work we do there is super special. Obviously, being an NGO, we really do need funding, we need support, and we need to get the word out there because it is so important. We only take generally late teens onwards, so it's not a place for children. It's more for adult therapy and also respite for the family members. It's a full day program, so it's from 9 to 3:30. And they're also able to socialize with people that have also suffered brain injury and understand them. Because as you can imagine, with personality changes and all these problems with cognition, and you can't talk or you can't walk and you're judged in a normal society, here you can be yourself, everybody's friends, and it's a super special place.
I think that's so fantastic. Thank you, Michelle Cahi, for joining us today on the Teen Junction podcast.
Thank you, Cindy. You're doing amazing work.
And you.
Please don't stop.
And you. So to everyone listening, we'd love to hear from you. Maybe you've suffered a concussion and now you're realizing after this conversation, hang on a second, that is really, really hectic. We are going to put the information about Headway in the show notes at the bottom of this. Maybe you'd like to reach out and speak about it. Maybe you're suffering depression, anxiety. You thought it was just a stressful job, but this could have been a concussion that you had as a teenager, now rearing its ugly head, for lack of a better term. Guys, it's serious. Concussion is serious. We can't take it lightly. As always, thank you so much for listening to this podcast. whether it be on Prime Media Plus or watching us on YouTube. We hope that you've benefited from it. And as always, thank you for your time. Take care.
It's sleek, fresh, and fast. Everyone, anywhere can hop on to primemediaplus.com.